the TUMG-HD10, DSMM-20, MajesTEC-5, which is the full name, to acknowledge all the study groups involved, is a phase 2 trial, as you said, that evaluates for the first time actually a bispecific, a BCMA-directed bispecific, in this case, Teclistamab, in combination with standard of care in transplant-eligible patients. And we presented here the first data on the induction therapy, which consists of 6 cycles, combination Tec plus Dara-RD or Tec plus Dara-VRD, 3 cohorts. One cohort had a weekly Teclistamab dosing, the other 2 were 4 weekly Teclistamab dosing, and out of the 4 weekly ones, there was 1 with Dara-RD and 1 with Dara-VRD. So that's basically the treatment lineup. And so what we found is that it is very efficacious, so it's really, really active. We found not only a really high response rate, but we saw that all patients already after 3 cycles, so half of the induction therapy, achieved a MRD negativity, at least for those where we had samples, and it was almost all patients. So I think that 2 samples or 3 samples left, missing out of 49 patients. So the MRD negativity was really high. All of the measured ones, technically probably 96 or 92% around. And with the first cohort having the longest follow-up, we also saw that after 6 cycles, so where all patients already had finished the 6-cycle induction therapy, that all of these patients in the first cohort actually achieved a MRD negative CR at end of induction. So this is, I think, something to build on, of course. But if you talk about BCMA bispecifics, of course, especially in combination, you have to look at the side effects, the adverse events, especially infections. And so what we saw with I have to say, quite stringent prophylactic measures set in place, like immune globulin replacement, IVIGs, as well as prophylactic antibiotics and antivirals. We saw that overall, so far, we had a 34, 35% rate of infections, grade 3 and 4. No grade 5, thankfully, all resolved. But of course, it has to be taken with caution, and also in terms of those delays in terms if a patient sees some, shows some signs of infection or something like this. So certainly, if you have an experienced myeloma center, it was very well manageable, as we say, but of course you need to keep in mind that it is not just Dara-RD, right? But it's very, very effective, and this is certainly something that has not been seen before in this extent in this patient population after 3 cycles already.